I am the Senior Director. Hi, my name is Becky Sanders. I'm the Senior Director of the Upper Midwest Telehealth Resource Center. Thank you so much for joining us today. Our topic today is going to be about patient and provider resources, and one of our UMTRC staff, Deena Dodd, is going to be sharing some information with us, and then we'll have a chance for questions. So we are recording today's presentation so that we can put it up on our YouTube page and allow others that are not here with us today to partake of this information. So without further ado, Deena, I'm going to turn things over to you.
Thanks, Becky. I appreciate it. Good afternoon. It's nice to be with you today. So Becky actually approached me about participating in today's presentation, and I just threw a couple of things together that I thought might be important for you all to have for knowledge. So to get started here, let me share my screen with everybody. Okay, can you see that, Becky? Is that live?
Yeah, can you do view, reading view?
You know what? Let me stop this. Hold on just a second, because I'm going to actually share it on my secondary slide, my secondary screen. How's that?
Beautiful, thank you.
You're welcome. Sorry, I knew when you asked that question that you were looking at the wrong screen. So really quick, we're going to talk about telehealth and patient and provider resources. So today, I just want to share with you some of the objectives. I want you to become more familiar with some of the resources that are out on the Upper Midwest Telehealth Resource Center website. The line that you see in this slide highlighted in yellow is a wonderful spot to find all of the material that I'm going to share today, as well as some others. We're going to break down what telehealth is so that you're a little bit more comfortable and familiar with the terms and having conversation around it. And then we're going to discuss a little bit about what the needs are with regards to telehealth. So I'm sure that you have heard the term telehealth for a really long time now. It's one of those words that came on the scene a little over 10 years ago. People were talking about it. We, of course, have transitioned. People have become a little bit more familiar with it. And then we got hit with a public health emergency, and it became all of the rage. So we want to make sure that you're up to speed on exactly how robust telehealth has become. So telehealth is, of course, the broad category where everything that is included in providing care and patient interaction, clinical and healthcare team engagement, as well as patient education services. It has taken on a really robust life during the public health emergency, and it is officially, as I've said before, the genie is out of the bottle. It is here. We are all embracing it. Now, telemedicine is actually a subcategory of telehealth, and that specifically refers to the remote delivery of care and clinical services by a physician, healthcare providers. In the state of Ohio, that looks a little bit different than the state of Michigan, Illinois, or Indiana, which is the area that the Upper Midwest Telehealth Resource Center covers. I know that for Ohio, your physicians and your nurse practitioners and PAs, as well as some of the other folks there in the clinical space in Ohio, can participate. One of the other elements of telehealth is called remote patient monitoring. And this actually is a wonderful tool for individuals, or for providers rather, who are looking to gather data and monitor patient health from a distance. So it's a placement of technology into a patient home, and it may send twice daily updates, it may send once daily updates, or it may be something that sends once every 3 or 4 day updates. So remote patient monitoring can look a variety of different ways, depending upon what the provider is monitoring, if you will. So who can participate in telehealth? And honestly, anybody can participate in telehealth. It can be beneficial for individuals who have distance challenges, folks who have potential transportation issues. If you're fragile and don't want to be exposed to individuals with other health challenges or disparities, or maybe you're just simply fragile because of the condition of your body, telehealth might be a wonderful resource for you. I know that during the public health emergency, we saw many individuals who were compromised, whether they had 1 or 4 comorbidities engaging in receiving telemedicine services. And that's just a really great way to access care, especially if you didn't want to get out during those really cold winter months and we're just looking for yet another reason to stay at home, if you will. So where can you find telemedicine or telehealth care? The best place to look for, whether it be a provider or a patient, the best place, of course, to look to initially start is your primary care provider. Now, for some folks, a primary care provider might be a nurse practitioner. It may be an MD. It may be, somebody that's in a different state, especially if you are a snowbird, if you will. So really utilizing what resources are available through your primary care are the best choices. Now, is your primary care the only entity where you can find or engage in telehealth? Absolutely not. There are many specialties, especially because of the public health emergency, who have gotten in the game and are also participating in telehealth services. Probably the best way to make sure that you can access them and to understand exactly what the scope of care that you have is available to you would be to contact your insurance provider. They can really identify for you what specific services are covered under your health plan, so that you know exactly what the opportunities are, whether you're at the provider level and looking to see if you can provide care to an individual, or whether it's patient level and you want to make sure that you have access to those services. Again, if you go to the UMTRC website, you will be able to find this slide, and it gives you some great details. So one of the things that I think is really important in the telehealth or telemedicine space is making sure that the patient is up to speed and comfortable with the idea of telemedicine and having an appointment with the provider that way. So this slide actually is one of those tools that a provider could actually have right in their office. It could easily become a mailer to get out to patients on addressing some of the concerns, how to prepare for an appointment with a provider, what to anticipate during the course of an appointment, and just relieving some of the anxiety that might occur for somebody who's never engaged in a telemedicine visit before. So I think it's really awesome that this could possibly be one of those tools that providers share with their patients. I know the first time that I participated in telehealth, even though I've been working with the Upper Midwest Telehealth Resource Center for quite a while, was I just wasn't sure what to anticipate from my provider. His office contacted me and said, you know, we'd really love to see you remotely. Are you comfortable with that? Well, sure, I'm comfortable with it. I think that's great. I love the idea of utilizing a resource that I talk about all the time, but I wasn't really sure what my provider's end was going to look like. So I was eagerly anticipating kind of getting an idea or getting a view of how my PCP was engaging with me and what his office looked like, and whether there was other activity in the background with him, or if it was like a traditional visit where I go into a room, my PCP comes in, and it's just the two of us having that discussion about whatever my visit was. So, you know, it's really an awesome opportunity as you're sharing resources, especially something like this with a patient, to be thinking about what your provider's opportunity is within the office structure, or maybe it's during his home hours that he is going to be engaging in this, but how he's actually going to provide those services and what that space is going to look like as well. It will help as you field conversations from patients, what they can anticipate from their provider. So again, wonderful resource. One of the things that I think is really helpful, specifically on this slide, is making sure that if you are engaging in an appointment, that you understand, that the patient rather understand that they need to be someplace quiet and someplace respectful of the meeting itself, that there should be no eating or engaging in other activities. I forget who it was shared with me the other day that they were in a space where a mother was actually having an appointment for their child. And they were doing it, I think, in the middle of a Target aisle. So a little bit challenging, not something that you would normally anticipate seeing. But if nobody had ever shared with her that that probably wasn't an appropriate space, or that there could possibly be material communicated to her in that space, that, you know, she's not in a HIPAA compliant space, and that whatever is conveyed to her in that, there's no onus on the provider to make sure that the material conveyed is HIPAA compliant. I mean, as far as, you know, if she's upset about that, that provider, that's not his responsibility or her responsibility. So I just wanted to share that little nugget of knowledge with you guys. So let's talk about what telehealth looks like by the numbers. And it's funny because people always think that the senior generation or the mature generation is not going to want to engage in new technology or in something that looks like telehealth. And the reality is that really isn't the case. You can see here Medicare users, telemedicine video calls per week before COVID-19, and then again in April of 2020 was 1 to 118, but they had 11,718% increase in 2 months. Think about that, an 11,718% increase in 2 months once Medicare users became familiar with the fact that they could still access their providers. So, and 99% of those folks engaging were satisfied with their coverage, and 64 of them said that they were very satisfied. So not only do senior folks love to engage in new technology, they're enjoying doing it. When we think about consumers and utilizing telemedicine and what it really looks like, this slide is really a great picture of what all can be addressed within the space of telemedicine. So we've got follow-up care for an acute illness, symptom diagnosis, medication management and prescription renewal being a pretty sizable portion of it, at 44%, a follow-up of care for a chronic condition. We all know, pardon me, that a number of the folks that we are helping to address, being within the Department of Health, that there are so many individuals that have got chronic conditions, if one, multiple chronic conditions. So at 34%, being able to utilize telemedicine and do it successfully, that is a wonderful way to better help that consumer to manage their comorbidity and to help them feel like they're more in control of it. Of course, we have remote monitoring of vital signs is a significant chunk, and then the behavioral and mental health factor, which I love seeing at 44%. How wonderful is that? The fact that people are taking advantage of the opportunity to see a provider, a behavioral or mental health provider, that's wonderful. So just again, a regional study, or the Regency study, I'm sorry, found that consumers can save $100 per visit with regards to, not having to think about childcare, possibly not having to travel maybe multiple miles to see their provider, and just simply staying in their home or possibly in their car to have that visit, maybe doing it over their lunch break. Means that they're not having to leave work and take time off of work or utilizing PTO. So just some of the great material on this slide to take into consideration, especially when you're talking to providers about why they might offer it or how they could offer it. I think this one just really speaks quite loudly, honestly, about the opportunities for hospitals and providers alike. So I mentioned very briefly telebehavioral health a couple of slides ago, and pardon me, I think that telebehavioral or telemental health, we all are familiar with what the foundation of that is, and it's just reaching individuals for either substance use, physical health disorders, possibly related or most often related to behavioral health, as well as mental health care for anxiety, depression, and other related disorders. 1 in 5 individuals in the US have been diagnosed with a behavioral health condition. 1 in 3 of those individuals are not currently having their psychiatric needs met. And then more than 4% of the rated psychiatric consultations are for medical inpatients. So if we can help reach more of those individuals and making sure that
Well, may I speak with Christina? Hello, Christina. This is IEA.
Thank you. Just making sure that we can get some of their needs met. I think that telebehavioral care can help address some of the stigmas that might be faced by those individuals. It's rather unfortunate that there is still a stigma around receiving care for mental and behavioral health challenges. But I don't want to be in the same community, which means I would have to drive, or I don't want my car to be seen outside of this specific doctor's office. Or what if I walk into the office and somebody that I know is sitting there and they recognize me? there are just so many areas of concern for an individual in that space that if we can allow them to engage in behavioral health or mental health telemedicine visit, that can just be dispelled immediately. They can still have prescriptions refilled. They are still able to talk about those concerns and apprehensions they're having. And really, it's just allowing them an access that helps them engage in a space that they normally may not actively seek out. So, and we all know that behavioral health and physical health and well-being are all intimately tied together. So what does it really mean? Telebehavioral health is simply connecting patients to providers to alleviate demand for or the need for more psychiatrists, especially for licensed clinical social workers who are able to meet the needs, but maybe engaging with psychiatrists on a certain level with some of the patients that they follow. It allows for meeting a growing demand for the patient need and reducing some of the strain on providers. It also means that there is an extension of treatment that can be conveyed to a patient and then communicated back to a primary care physician almost without a lot of effort. Oftentimes those communications are done through the electronic health record. And if that caregiver is tethered to the same EHR that the primary care physician is, those notes drop and they're immediately there for the PCP to review as well. So just really quickly, long story short, telehealth, telemedicine is really connecting patients to providers easily and oftentimes more economically. It allows patients to seek out providers regardless of specialty, as well as regardless of location. It certainly reduces waste because there are less no-shows. Patients can't say they can't get there, and oftentimes they are more apt to participate simply because it is as simple as picking up their electronic device and saying, hey, I can give this 10 or 15 minutes of my time because I can go right back to work, or I can go right back to making lunch for my loved one, or I can do this because it's not taking me away from my desk or what have you. So it certainly means that more money is being made by providers because there are less no-shows for those providers. And of course, it allows for patients to feel more like the provider is more invested in them. And that's just simply because the provider is more apt to look at the screen when they are having a telemedicine visit and not their EMR screen. So I'm sure we've all been in that space. You go to see your PCP and they swivel to input their notes instead of staying present and front and center with you. So what's really nice is that when this is going on like this, they can still take notes and still be front and center with that individual. So it's really a wonderful way to provide care. I know I covered a lot of material today. I apologize if there was any redundancy in it. That was certainly not my intent. I do want to make sure that you all are aware that it can all be found on the Upper Midwest Telehealth Resource Center resource page. And of course, as Becky noted earlier, I do participate in that. So if there are any questions, concerns, or if you'd like to have a follow-up on anything that I said today, you can either reach out to myself or Becky Sanders, and we would both be very happy to provide any details for you or to somebody there in your organization that have questions, comments, or concerns with regards to telehealth and the execution of it.
All right. Thank you so much, Deena. Great words of wisdom. And so today's program, as you'll note probably on the slides, is brought to you by the Ohio Department of Health. And as I said at the beginning, we have recorded this session today so that it can be accessed later through their website for anyone that wasn't able to join us today. So at this point, I'm going to ask Carolyn to go ahead and stop the recording.